My name is Gosling. I'm a white woman with pale olive skin, a self styled hennaed corona crop, and green eyes behind black plastic glasses. I have black wrist braces, silver coloured jewellery, and a rainbow brooch and watch strap. And I'm wearing a dark purple silk shirt and black leather blazer. Behind me are rainbow flags, and I'm sitting in a silver coloured manual wheelchair with bright orange rim covers and a lime green fake fur cover. For the last 20 years, I've been a co chair of Regard, the national LGBTQI disabled people's organisation. I mean by this that we identify as part of the international movement of organisations led by disabled people ourselves. Founded in 1989, Regard has four aims: to highlight disability issues within the LGBTQI communities, to highlight LGBTQI issues within the disabled communities, to combat social isolation amongst LGBTQI disabled people, and to campaign and work strategically on issues that particularly impact on LGBTQI disabled people. Regard has no core funding and no staff. Instead, the organisation is run by the members for the members, who are mostly LGBTQI disabled people ourselves, although we also offer associate membership for organisations and allies. In order to be as effective as possible, we have a large executive committee, and each person takes responsibility for one or more areas of work, regularly reporting back via email to the group. So, for example, we have members representing and working for the interests of people with learning difficulties, people with HIV and deaf people, members liaising with the disability and LGBTQI communities, members focusing on issues like social care and hate crime, and so on. We always need new executive committee members, so please do bear this in mind. We also have a Facebook page, a website, and a daily email group for our membership, where we circulate all of the information we receive about other activities, news, and campaigns from the disabled peoples and LGBTQI communities. However, many disabled people are digitally excluded, while others have no privacy and cannot be out because it's unsafe, limiting our reach. As many as 1 in 3 of the UK's LGBTQI population are disabled, compared to 1 in 4 or 5 of the overall population. This is due to the long term impact on our mental and physical health of discrimination, together with a higher incidence of HIV among gay and bisexual men. It's still common for someone to be rejected by our family or to have only superficial relationships with them, to be rejected by our childhood friends and to leave the area where we grew up, to have to hide our identity all of the time we're at work, to experience additional difficulties in meeting partners and setting up home together, and so on. This is extremely damaging to our mental health and also leads to behaviours such as addiction that cause long term damage to our physical health. Then there are people who never recover from physical attacks linked to discrimination, including head and spinal injuries. Stonewall has found that LGBTQI disabled people experience much higher rates of hate crime than other LGBTQI and disabled people, and generally are the most disadvantaged of all disabled and LGBTQI people. Many LGBTQI venues are inaccessible due to environmental, social, and attitudinal barriers. And this means that LGBTQI disabled people are often very isolated indeed. This in turn impacts on our mental health and makes us vulnerable to hate crime, including mate crime, where people posing as befrienders take over an individual's home and resources. Regard works to highlight the fact that LGBTQI hate crime victims are overwhelmingly disabled and pushes for policymakers and service providers to recognise this. We lobby organisers of prides and other LGBTQI plus events to implement our own guidelines to inclusion and accessibility, which you can find on our website www.regard.org.uk. We raise awareness of repeated failures to include disabled people with event funders. From now on, I'm going to include some poems which have been written in the last 12 months about the experiences of LGBTQI plus social care users and other disabled people during COVID-19. So, for anyone who's feeling particularly vulnerable, I'm going to issue a trigger warning and suggest that you take a break from your live event and then come back for the last 10 minutes, which will be a question and answer session. If you wish, you can always choose to view the rest of this video another time on the Regard website. I'm going to begin with a poem called Careless, which I wrote last June, Pride Month. The story of our disabled community is the story of the wider LGBTQI plus community too. The majority of people become disabled in adult life, and 2/3 of disabled people are over retirement age. Careless tells the fictional stories of social care users in the first 4 months of the pandemic, based on all too common real life experiences, the shared factors in our history that make us particularly vulnerable to COVID-19 now. Without being able to draw on significant support from family members, childhood friends, partners, and children, LGBTQI plus disabled people have no option but to access state services and are heavily overrepresented amongst social care users. This includes care home residents. A national shortage of accessible and supported housing means that LGBTQI plus people of all ages are living in care homes. When LGBTQI plus people do use social care, research carried out by Regard with the University of Bristol, Stonewall, and the Social Care Institute of Excellence shows that we experience widespread discrimination. Again, partly because lack of community and family support makes us more vulnerable. Regard works closely with the Care Quality Commission, which regulates social care, the National Institute for Clinical Excellence in Social Care, which sets standards, and the Social Care Institute for Excellence, which creates practice guidelines for social care workers and policymakers. We also succeeded in the noughties in implementing monitoring of care home residents' sexual and gender orientation, although this rule is often ignored. Far from being encouraged to be out, before the Equality Act 2010, members living in care homes reported they were told they would be evicted if they came out to staff or other residents. More recently, out members have been asked to leave their care homes on the grounds that their peer support needs cannot be met and their safety from other residents not guaranteed. Careless. Pete isn't a dad, though he's somebody's son. Ellen is lovely, but nobody's mum. They both left home early and haven't been back. The same's true of Trudy and Melvin and Jack. Sue's not seen her kids since she came out as trans. Bill's son avoids him whenever he can. Trevor's lost touch with his sisters and brothers. And Kath's son has simply no time for his mother. Pete wasn't able to come out at work, so his friendships were limited, much as that hurt. He found love and found it again, and lost it once more, which has caused him great pain. Trudy's another who stayed in the closet. Her life and her livelihood both rested on it. Her happiest moments were clubbing at night, but she daren't risk it often, despite the delights. Ellen found her true love early in life, but wasn't entitled to call her a wife. And cancer came long before change in the law. So she's labelled a spinster which makes her feel sore. Melvin has had a substantial career, successful and wealthy despite being queer, but developed MS when aged just 43, so his money was taken to pay his care fees. Jack spent his working life wielding a broom, sleeping and eating in one tiny room. Kicked out by his parents, he took no exams, and his minimal wages were paid cash in hand. Sue knew she was different when she was a girl, misgendered, disguised, and with massacred curls. When 3 decades later she found her true self, a judge took her children, then life took her health. Bill's lifelong partner is great and called Dan, but Bill has dementia, and once it began, since they couldn't afford to become partners in law, Bill's son got control and then showed Dan the door. Trevor trained as a teacher and worked in a school, till arrested and outed and sacked under rule. His crime being only to love until death, a dear man whose sudden loss left him bereft. Kath led a happy and sociable life, not wanting to settle for only one wife, but her son signed her over to state social care. Only family members can visit her there. It was March 2020, and all through the land, infection was spreading with each shaken hand. With each missing mask and each failure to act, with each mass event, each denial of fact. Then across England the coughing began. Throats filled with glass and eyes filled with sand. People struggled for breath as their fevers soared high. And the promised protection was founded on lies. Pete died the first week and stayed where he lay, till the carer who gave it him came the next day. Ellen died next after going to shop. She'd had no choice as her social care stopped. Then Trudy and Melvin and Kath became ill. And soon so did Jack and Sue, Trevor and Bill. As infection raged through 1 in 3 of care homes, with visitors banned, they all suffered alone. At the time of their passing, their deaths didn't count. It took far too long for the pressure to mount. And while they were dying, no ambulance came, since a doctor had put DNR by their names. No one wrote tributes to mum or to dad. No grandchild complained that their treatment was bad. Voices were silent or spoke the belief that for old and sick people, it was a relief. No services marked their departure from life. No films were made for a husband or wife. No graves exist, and their ashes lie spread where no one can possibly notice they're dead. Now it's Pride Month, and still people are dying. Quietly, lovers and friends are still crying. Rainbows on windows served only to hide the rainbow that faded, then vanished inside. Sadly, as we're all aware, nothing has changed in History Month 2021. Care home residents are still dying in large numbers, and LGBTQI plus care home residents continue to be among those with the least support from relatives and the heaviest dependence on state funding, meaning they're living in the poorest standard facilities. Now, with COVID-19, younger residents who are themselves in good health and usually lead an active life in the community, and many working age disabled people spend years in residential care due to housing shortages. They've also been trapped in their care homes for nearly a year now. What is not more commonly known is that social care users in the community have the same high mortality rate as people living in residential care. Despite this, we've been denied the same priority for testing and vaccinations. In both cases, no records are being kept about the victims' sexual and gender orientations, but the unique circumstances of our community means that LGBTQI plus social care users are likely to be overrepresented amongst those who are dying in the community too. My partner and I have been shielding at my home since mid March last year. We've had no visitors, no voluntary help, no family support, and no support from our own community. Without this support, we haven't been able to negotiate the local authority system successfully and obtain the PPE that we need for our social care users to come in. This means we've been locked down with our assistance dogs in Newham, one of the worst affected local areas in the world, reliant on deliveries and without access to our usual medical treatments. If we become ill, there is no emergency plan. However, to date, we've managed, so we're the lucky ones. Many more LGBTQI plus social care users won't have coped without the support structures that are available to straight people. I wrote the next poem, Metamorphosis, paused last spring when shielding was still being described as cocooning. Metamorphosis paused. A cocoon is a miraculous creation containing everything needed to survive. A grub is reborn in blissful unconsciousness, emerging with unimagined abilities, soaring on wings to a richer new life ahead. Caterpillars do not lose their rights when they enter into their cocoons. Caterpillars do not need to prove larvae status in order to eat. Caterpillars do not have to worry about how to wash their hand splints. Caterpillars do not struggle when they try to make a telephone call. Caterpillars are not abandoned without masks and gloves for their carers. Cocoons are insulated against dealing with officialdom. Cocoons do not rock with emotion nor shake with fatigue. Cocoons do not crack with every essential delivery. Cocoons do not splinter with every essential visitor. Cocoons promise futures, not lives perhaps permanently on hold. Cocooned is not waiting anxiously for neighbours to go in so you can clear up after your assistance dog in safety. Cocooned is not being enraged by reckless politicians and the selfishness of people sauntering past your front door. Cocooned is not always missing the people you care about. Cocooned is not being in fear for the lives of those you love. Cocooned is not having rows with the loved ones who are present. Cocooned is not sweating with panic each time the doorbell rings. Cocooned is not being breathless with pain as you cope alone. Cocooned is not being ever watchful for approaching death. Shrouded round in dread, we are not cocooned, we are suspended. In February 2021, the situation facing LGBTQI plus disabled people, and that could be any one of us tomorrow, is extremely serious. The vast majority of day services that many social care users previously relied on have not operated since last March. And as with ourselves, many people have also had to choose between receiving unsafe care at home and no care at all. This has also impacted on social care users' access to food, since many people were used to receiving their main meal of the day as part of a day service. Covid-19 is the biggest health challenge facing our community since HIV. Despite this, there's been no action from Stonewall, who refused to object when the coronavirus emergency bill significantly cut social care users' right to care. In fact, Stonewall's acting chief executive was on furlough when the bill went through Parliament, and staff at work told us that the only issue they saw with the bill related to civil liberties. Nor have we seen any moves by Stonewall to support vulnerable members of our community to get safe access to food, let alone more holistic help. Regard has tried hard, but alone we have been unable to get the government to accept that LGBTQI plus people have, as with other minority groups, been disproportionately affected by the COVID-19 pandemic and so need targeted monitoring and action. Overall, the UK has one of the highest proportions of COVID-19 patients who die from their infection. My final poem, also written in 2020, responds to the QALY system, spelt QALY, that underpins every treatment decision made by the NHS. QALY stands for Quality Adjusted Life Year, and the cost of treatment must always be less than the QALY value of the patient. I leave you to imagine the potential that this system has for unconscious bias and discrimination to impact on treatment decisions. My partner Julie, who is 73, uses a wheelchair and has COPD. A few years ago, she was featured in Claire Summerskill's book about our community elders, published by Stonewall. Julie was told last year by our GP that she would only be offered palliative care if infected with COVID-19. Care, which he explained, could simply mean a package of morphine being dropped off. There's no guarantee that myself, as a wheelchair user who's 15 years younger, would fare any better. In fact, our entire economic and political system is based on the assumption that some citizens' lives are worth less than others and are expendable. Compare the much lower COVID-19 mortality rates in countries where the life of every citizen matters in law. Quality of life. How much is my life worth, and how can I tell? There's a formula that I know only too well. My life is costed by symptoms, you see, not the value it has to you or to me. You can't fetch top price if you roll round on wheels, even a businessman making big deals. There's a further discount if you can't hold your wee, even if you are an active MP. If you can't see too far or simply can't hear, your life is not considered so dear. There's more off if you need support from another, even if you are a competent mother. And pain is considered a definite no, whether or not people in pain say so. The government costs you before they will give the NHS treatments that you need to live. Your life must be perfect to gain a full QALY before you are even put onto a trolley. If you can't leave your house, then your value is cheap. The state won't spend much money for your life to keep. And maybe that's one reason more people die of COVID-19 in the UK. And I am afraid of the verdict if I become ill. Before I sleep, I have miles to go still. We may be a good parent, a partner, or neighbour. Whoever we are, we're all more than our labour. Yet, whoever we are, our lives are still judged on our cold market value, not how much we're loved. These slavery values must come to an end. What kind of price can you put on a friend? Your brother, your grandma, your child, and your wife? How can a price be placed on their life? The values that matter are those we all share. How much we give and how much we care. It's time to abandon the checkbook approach. Love is the quality that matters the most. In 2021, we need the power of love more than ever. Love for ourselves, love for each other, love that leads to action, that leads to change. Together, we can change our world.